Welcome to Rainbow Kitty's channel for parents. Nurture emotionally healthy children with us.
Causes of OCD. The causes of OCD are not fully understood. Some of the main theories include autoimmune-related causes. OCD may be a result of changes in your body's chemical or brain functions. Sometimes, symptoms of OCD appear in children after an infection, including strep throat, H1N1 flu virus, etc. In such cases, the symptoms start suddenly and reach full intensity within 24 to 72 hours. They may then disappear but return later. Genetics could be another cause. OCD may have a genetic component, but specific genes have not yet been identified. Further, imaging studies have suggested that the brains of people with OCD function differently. Genes that impact the brain's response to neurotransmitters like dopamine and serotonin may also play a role in causing OCD. Behavioral causes. As per this theory, the initial fear may begin around a period of intense stress, such as a traumatic event or loss. Once the child associates an object or circumstance with this feeling of fear, they begin to avoid that assumed cause. As per research, this might be more common among people with a genetic predisposition for the disorder. Cognitive causes. Most children have irrational thoughts at times, but for those with OCD, the importance of these thoughts becomes extreme. As a result, in response, they take excessive, continual action to prevent the threat or danger. For instance, a child under intense pressure might feel that they might harm the person who they believe might be causing it. It might be a parent or teacher. Under normal circumstances, they might simply avoid such thoughts. If having OCD, such thoughts become excessive, and they find solace in some ritual to prevent it from happening. Environmental causes. Stressful life events may trigger OCD in children with a predisposition to it, genetic or otherwise. Many parents have reported that the symptoms appeared within 6 months of events such as severe conflict, serious illness, or a traumatic brain injury. OCD might also sometimes occur alongside post-traumatic stress disorder or PTSD. Risk factors for OCD. Factors that may increase the risk of developing or triggering OCD include family history. Having parents or other family members with the disorder can increase a child's risk of developing OCD. Traumatic experiences. Children who experience physical or emotional abuse have a higher risk. This could also include traumatic childhood experiences, like bullying, severe neglect, or sexual abuse, etc. Other mental health disorders. OCD may be related to other mental health disorders, such as anxiety disorders, depression, or attention deficit hyperactivity disorder, ADHD. ADHD is a mental health condition that can cause unusual levels of hyperactivity and impulsive behaviors. The child might have trouble focusing their attention on a single task or sitting still for long periods of time. In addition, they can be forgetful about completing tasks. They might also interrupt people while they are talking. Tic disorders like Tourette syndrome is another risk factor. It is a syndrome that involves recurrent involuntary tics, which are repeated. These are involuntary physical movements and vocal outbursts. Other factors could be social anxiety disorder, eating disorders, or substance abuse. In fact, majority of the people living with OCD have another mental health condition, with anxiety conditions being the most common. That said, having one of these conditions does not automatically mean that you are more likely to have OCD. Personality could be another risk factor. Children who have difficulty handling uncertainty and responsibility, or are perfectionists, may have more chances of developing OCD. However, there is some debate over whether these are fixed traits or learned responses that can be changed. According to a 2021 study, symptoms of OCD could also appear for the first time following a head injury. Complications from OCD. Problems resulting from OCD may include excessive time spent in rituals resulting in disrupted routines, health issues such as dermatitis from frequent hand-washing, difficulty engaging in play, school, or social activities, low self-esteem. Imagine having physical illness, sometimes due to stress, trouble forming or maintaining friendships and other relationships, overall poor quality of life, and suicidal thoughts and behavior in some cases. Prevention of CD. There is no exact way to prevent CD. However, getting treatment as soon as possible may help prevent it from worsening and from disrupting normal life. Watch first part to know more about signs and symptoms of OCD, and the consecutive parts to know about the treatment options, related conditions, and support available for OCD. Links are in the description.
Like, share with your fellow parents and subscribe to get notified.